Kia ora, nau mai, haere mai, and welcome to today's Whanau Whina Plunkett live chat. Welcome to all the whānau out there. Thanks for joining us today. My name's Maxine. I'm working for Plunkett at Plunkett Line, and I'm joined today by Dr. Anna Gilmour. Welcome, Anna. How are you?
Kia ora. Yeah, I'm well. Thank you. Thank you for having me.
Awesome. Thanks for coming on. So, Anna, tell us a little bit about your role.
Yep. So I'm a GP in Dunedin, and my role here, general GP work, but I also run an allergy clinic. So I studied allergy in Australia some years ago, and so I have an allergy clinic, and as just recently have started as a sort of a shoot off of that, an eczema clinic. So I see a
Awesome.
lot of families with eczema in my allergy clinic, and so we've sort of started a separate service.
That sounds amazing. That sounds really interesting. So that's why we've got you here today, is to talk us through a big topic when it comes to eczema care. We've been on the skincare eczema Facebook live chat mission for the last month. And so today we are rounding off this fourth skin chat about anxiety and the emotional burden of eczema for our whānau out there. So if we're to kick off that sort of conversation, let's start at the bottom. What are we talking about when we mention the anxiety and emotional burden of eczema?
Mm. I think it's quite huge. You sort of don't think about it unless you're affected by it, I think. And so eczema itself is a very disruptive condition because it is so itchy. And so it's got a couple of effects. One would be on the individual suffering the eczema, and just how disruptive that can be in terms of their ability to sleep, particularly, but also to function normally in the day. And for children, particularly school children, they're often very self-conscious about their eczema as well. So, and then there's the sort of extra burden on the family and the whānau, and caring for the eczema, particularly again with the younger children, and just the time that's required for that, and the emotional energy that's required for that, because it is a relapsing chronic condition that doesn't just get cured easily.
That's right, and it's such a big thing to learn as a parent when you're getting to know your child, getting to know what works for them as they're growing, they're developing and changing. So, in the under fives, it's a massive issue, isn't it? Especially for first time parents, maybe.
Yeah, absolutely, and it can be really all consuming, and often
Mm.
make people think, well, gosh, if I was to have more children, how would I possibly cope with more than one with this condition? So it's certainly certainly very disruptive and very worrying. I think parents feel that. As you do as a parent anyway, and particularly a first-time parent, it's sort of natural to
Mm.
feel guilty or that you're doing something wrong, and caring for your children, and actually not, perhaps not fully understanding that that there are things you can do to help, but you're probably also going to find that it's not as straightforward as finding the answer.
Absolutely, because it is a long game, like you said. It's a chronic condition, and it's around, as the parent, figuring out what works for your child, what your eczema routine and regime sort of looks like. Um, that can take a long time in itself, can't it? A lot of trial and error.
Yeah, absolutely. And I think too, the advice that people get is sometimes a bit mixed. So
Mm.
so you might get some advice from Nana or from someone along the street, and equally your GP may give you different advice to a different GP or a different specialist. Subtly, the messages are usually similar, but when they're slightly different, you can get quite confused and feel like, oh gosh, where do I go?
Mm. So, what sort of advice would you have for parents that are at that stage of just trying to get their head around this whole thing that is eczema for their child?
I think I would say that, and this is true of any sort of condition, I guess, that chronic condition that your child may develop, is that it's not your fault. That's probably a big one to remember, and that there is help available, and that you don't have to feel that you're alone with it. There's some key messages that people often appreciate hearing, I think, even though they don't change the situation. And I think it's just helping understand where that help can be best received. And so I think, yeah, and just making sure that they are looking after themselves and not blaming themselves.
Mm. And I suppose you would see quite a bit of that in your practice, that sort of situation that whānau are in.
Yeah, absolutely. And it's not just eczema that keeps kids awake. You get your
Mm.
child with perfect skin who doesn't sleep
Mm.
well. And again, those parents blame themselves. Is there something I'm doing wrong, particularly first time parents? So
Yeah.
there's a lot of support, I think, needed, and there is
Mm.
support out there that as long as you're looking in the right places, that you can
Mm.
receive, and just making sure that you access that.
Mm. So where would the main supports be for parents out there in terms of eczema?
Yeah, so I mean, Plunkett's always been a great support in terms of my patients that I see, and early in the early stages in particular. And I guess through community support groups and through the GP, often the GP is pretty
Mm.
well connected. I'm not sure about the rest of the country, but we're very lucky that we have a health coach in the practice who is a free service and can help link people into support agencies, and also provide some education and things all for free for patients. So many practices and PHOs will run a program like that. But yeah, it's and often through antenatal groups or support groups, even just groups of friends, they will know someone. Eczema is common, so it is something that will affect others. And if you ask widely enough, you generally will find how others have received support. And also, the other thing to remember is that it is something that often does run in families. So within the wider whānau, there's probably someone that has had some experience and some tips, and at least someone to share your trials and tribulations with as a parent.
Yeah, and being able to get that support, that moral support, isn't it? That emotional support for others that understand, from others that do understand. Um, so just going back to what you said there around, the different areas where you can get support, your GP is definitely one of the main ones, isn't it?
Yeah. We like to think so as GPs, and
Yeah.
so accessing that, often GPs will feel a little bit sort of helpless sometimes too, because particularly when eczema is really bad, it can be a difficult thing to get under control. And
Mm,
although GPs will be giving the same messages throughout that we will in eczema clinics around the country, I think often there's a time factor there. And so I think that's where the utility of having a look at the likes of the Kids Health website and
mm.
videos and things like that can just spend that little bit extra time talking you through the finer details of how to care for eczema.
Yeah, yeah. So knowing where those resources are when you can't access your GP, in a timely, manner, but also just in general, keeping up that relationship with your GP and going back if the cream that you've got at the moment or the plan that you've got at the moment doesn't seem to be working, because it is with your GP that you're going to figure out which particular moisturizers or steroid is going to work best for you, and where you create that eczema plan. Hey.
Yeah, absolutely. Yeah, and it is something that's quite individual. A lot of
Mm,
medical care. If a child's not responding to one cream, or they're finding it really stings or something like that, then it's a
mm.
matter of returning and finding something that does work for you, because we're all different.
Yeah, That's definitely a really good point. We are all different, and yeah, we need to figure out what works, and we need that support from our GP to be able to do that. So
Mm,
yeah, those links that you mentioned, the Kids Health links is a really good resource for parents out there wanting to just get that extra information, and you can revisit those videos and those information pages over and over again until you feel you understand it. So we'll post up those links to the websites and resources there on our Plunkett page, on our YouTube page and our Facebook page. So that will be useful.
mm,
So look, delving a little bit deeper, let's talk about the impact of eczema on not only the parents managing it and the the whānau dynamic as a whole, but on the child.
mm. Yeah, and I think you often see, well, I see in clinic toddlers or preschoolers who are sort of seen to be as very very difficult children,
Mm,
and then once their eczema is well managed, they're actually much much easier to be around and easier to parent. And I think
yeah.
that's just demonstrates how very uncomfortable it is, how
Mm,
when sleep's affected, it affects temperament. Um, as well. And then I guess the older group, so the later primary school age children,
mm,
and definitely intermediate and high school age children,
mm,
will often get quite a lot of comments about their skin, and will often be very self-conscious, and
mm.
that can be quite remarkable how much that impacts those children and their self-esteem. And of
Yeah,
course,
and
the
their
worse they
confidence.
feel,
Yeah.
yeah, and of course, the worse they feel about themselves and the more stressed they feel, the worse that will make their eczema as well, because we all know stress has an impact on skin.
Absolutely. Yeah. And it becomes a bit of a cycle, doesn't it? So, the lack of sleep, the lack of rest, the lack of kind of body getting to replenish itself, the more the flare-ups are gonna come. And same with the stress. It is a real balancing act, eczema. It's the whole way through. So I think looking at the under fives, it is the sleep is a real issue, and the itch. It is just so disruptive for them, like you're saying. I think it
Mm.
goes to show how overwhelming eczema can be for these little ones in a physical sense, and it really does affect their behavior and their coping, and all of those things that we might see more as, acting up or playing up or lashing out. But especially when they're young and they don't necessarily have the words or the vocabulary to tell us what's going on, it's really important to read between the lines a bit, isn't it?
Absolutely, yeah, and recognizing, and this is true of anything in medicine as well, that that the physical part of the body is completely connected to the mind part of the body. So if we do have something with our physical health going on that's
Mm,
affecting us, then naturally our mind will be, not in a great spot either. The saying that really gets under my skin came from somewhere, and
mm.
certainly skin is a very emotional organ when we think about it like that.
That is a really good point. Yeah, it is. And it can affect so many different aspects of your life, as you're saying.
Mhm.
Um, so what sort of advice do you have for parents, or any top tips around managing that aspect of it for your little one? The stress and the discomfort, and just making them feel a bit better about it.
Mm. One of the things that I think is tremendously helpful and probably underrated is wet wrapping,
Mm,
as a tool to manage the eczema. It doesn't work for everybody. Not every child will accept it, and not it won't always be the panacea. But for children who have tried everything and tried every cream, and parents are a bit at their wits' end, often just that wet wrapping on top of the emollients and steroid creams at night will be enough to cool the skin and allow for an effective sleep pattern, if nothing else.
mm,
And then often you see some improvement in the skin from there once the sleep improves, once things are
mm,
cool and comfortable. Another piece of advice I would say is, which is underrated as well, is is just ensuring that the room isn't too warm, that the house isn't too hot. We like to keep our kids warm, and we feel we're doing a bad job if they're not. And obviously, you don't want them cold, but at the same time, too warm is really uncomfortable when you've got eczema. I've got a guy, a 15-year-old at the moment, who I've managed his eczema for a long time, and he said that the best thing that's happened recently is his mum and dad have kicked him downstairs to the sort of the play area, kind of, or
Yeah.
the extra sort of flat, and he's living downstairs, and he said it's much cooler and my skin's never been better. So things like that are easy to think of as being simple and not making much difference, but often they will.
It is those things, isn't it, that just make it a lot more comfortable for them to exist
Yeah.
and just experience their body in their day-to-day life. And that's a really, really good point that you make about the cooling down the skin. And with our little ones, with our pepe, with our tamariki, especially in winter, we got merino and layers, and everybody wants to wear onesies and hoodies at the moment and stuff. And that stuff's all wonderful, but for our eczema kids, it's going to irritate them. It's going to heat up their skin, which is going to worsen the itch, and it's going to dry out the skin. And so it's those sorts of things that, will help our babies come down. So with our toddlers, say, who have quite a lot of eczema, if they are really stressed out, they are really playing up maybe lots of tantrums, lots of tears, that is a really good port of call to, see, okay, maybe I need to take some layers off. Maybe I need to cool them down, cool the environment down, keep up the hydration, and the water is a really good one too, isn't it?
Absolutely. And I think sometimes, I mean, depending on the age of the child, obviously, you can even start introducing things like mindfulness in a child-friendly way,
Mm,
and encouraging kids to do sort of breathing exercises and relaxation exercises and things once they're able to communicate and understand. And that at
mm.
bedtime is tremendously helpful too, because the more worked up we are, the more angry and inflamed the skin will be as well.
Absolutely, absolutely. So, just if you're just joining us now, welcome to our live chat today. We are here with Dr. Anna Gilmour, GP with special interest in eczema, joining us to discuss the anxiety and emotional burden of eczema on our whānau, parents and children's alike. So, yeah, disruption, to the family and especially to the child with eczema, it might lead on to, decrease in school attendance and decrease in, kindy attendance, and then really tired children that need to stay at home. That it can really fan out and affect the whole family in a lot of ways. Hey.
Mm, mm. And that older age group as well, and the children at school, you often see coming into summer that they're reluctant to attend school, perhaps because their skin's so bad that they're worried about going to swimming, putting togs on, and getting in the pool and things like that. So then there's the potential that they will not want to go to school, and not also perhaps want to talk about why they don't want to go to school if they're not if they're feeling that they're lacking confidence and self-esteem.
So what's some good sort of ways to combat that or options for our, maybe older children or our, older kindy kids?
Mm. Well, I think often it does just come down to making sure that the appropriate education is there in terms of accessing those resources,
Mm,
ensuring that you're doing absolutely everything, in terms of how you put creams on, when you put creams
mm,
on, whether they're creams that are making things better or worse,
mm,
reviewing things with the GP, and getting the skin to a point where it's as good as it can possibly be. But also,
mm,
on the other hand, and obviously this is something that we want to focus on for all children, is just building up children's self-esteem, helping them
yeah.
to feel good about themselves, regardless of what their skin looks like. And there's
Mm,
so many great resources that can help with
mm,
that. I think one of the websites that's going to be posted is the Skylight website. Skylight
mm,
Trust is involved in providing a lot of or sourcing a lot of resources that can be used to help help parents and whānau to understand the emotional needs of themselves and their children. So it's a great place to go to.
Definitely, and that's a really, really good point. Is building them up anyway, regardless of what sort of cycle their eczema is in at that time. Um, Another good thing, in those terms would be, especially with our older preschoolers, but even our toddlers, teaching them from a really young age to take steps to care for their own skin. That can be quite empowering for them as they get older. So if you're feeling itchy, getting that tub of moisturizer that is there for them, making sure they've got clean hands and going and rubbing it on, and that can really support them to get their own sort of action or aki on when it comes to the eczema. I think it's really, really good to look at it throughout the time frame, though, the lifespan, because we do focus on the under fives here at Plunkett, but we know that these children are being set up for life, and these are things that they could, and the families, the parents that are going to take through long past the age of 5. My my eldest daughter has eczema, and I remember it in her younger years being very tough. For her, very uncomfortable, lots of back and forth to the GP and flare ups. And for myself, feeling really, really stressed having to manage that. And the amount of learning, the learning curve that came along with it was just huge, really, really big. So I think it's really important just to acknowledge what parents are going through out there, and awesome the message that you're putting forward, Anna, that there is support out there and it's important to reach out for it.
Mm.
Yeah, it's really good that there are lots of supports out there.
Yeah, one of the other ones that we haven't mentioned is the sort of school supports, in terms of
Mm,
school counsellors and services that come to schools. We've recently, unfortunately, had the chat bus, which used to come around Dunedin schools, is no longer available because, again, it was a
mm,
trust. So although there is a huge mental health need and shortage in providers, schools will be able to access someone, and public health nurses
mm,
have, each school has a public health nurse who would be able to
mm,
provide advice too. And some of those Skylight links and websites actually link into support helplines and support that way too.
absolutely. Yeah. And so looking after yourself as a parent, providing care for these kids with this special skin need, and, walking alongside them through their eczema journey. You're there the whole way when you're a parent, and it is tough. So recognizing that it's okay if you're feeling overwhelmed, and it is a really legitimate reason to feel totally stressed and concerned. Um, if you're there, reach out for support, talk to your GP. Like Anna said, check out the Skylight website. There's some really great resources. And if you feel you need to talk to someone, please call us at Plunkett Line on 0800 933 922. What would your key messages be, Anna, for whānau out there?
Key messages are, make sure that you've got a good connection with our GP. So ideally the same person that's seeing you each time. I know that's not always possible. And maybe even, I mean, we know that appointments are free for under 12s. And so
Mm,
even if you were to regularly have a follow-up appointment with the GP, rather than a one-off, sort of, go, let's get this eczema sorted, and then you don't see them again for 3 months, in which time things have come and gone. It's really useful to actually have a fortnightly appointment or something like that, just so that you can touch base. Well, actually, it's flared up. Why is it flared up? What have we been
mm,
doing differently, and how can we improve that? Those sorts of things are really useful. So in terms of managing the skin, that's my top tip. In terms of managing yourself as a parent, my top tip is make sure that you've got support, and that you access that through whatever channels you have. But if you can't think of any immediately available, then the GP will be able to help direct you in Plunkett Line as well. and
Mm.
looking after yourself, making sure that you're sharing the load with someone. And I think for children and tamariki, just making sure that their needs are cared for in terms of their self-esteem and their comfort, and that that you can, as a parent or whānau,
Mm.
practice discussing how they're feeling and what, how they can help manage themselves as they get older.
Yeah. Awesome. Awesome. That's really, really useful. We've just had a question come through around, eczema and getting in, not always being sure whether it is eczema or not. If you're in that kind of maybe really early stages or just grey area of figuring out what it is, what would your advice be to families?
Well, GPs should be available for that. I think that they're probably the ones who see the most eczema. Dermatologists are great, hard to come by, and probably don't see as much acute eczema as general practice.
Mm,
So I think in terms of knowing what it is, if there's any doubt in a GP's mind, they would be seeking advice themselves. But generally, if it itches and it's
mm,
red and it's then it's eczema almost certainly, at least in
mm.
children. But yeah, I would trust your GP.
Yeah.
And if you feel like you need another opinion, then ask where the nearest eczema clinic, whether that be through the paediatrics service in the local hospital, or whether that be
Mm,
privately, or whether that be through an eczema clinic in primary care. There are
mm.
options.
Yeah,
Mm.
absolutely. Awesome. Hey, look, well, thank you so much for joining us today. It's an absolute pleasure to chat through this topic with you. Big topic, but keeping it succinct it is really important just to, you know, keep the focus sometimes on, you know, managing your own stress, managing the stress and discomfort for your child, and looking after yourselves as a whole.
Mhm. Absolutely. You're very welcome.
Cool. Awesome. Well, you take care, Anna. We will post up those links on our Facebook page. And any other questions, feel free to call us at Plunket Line 0800 933 922. Ka kite.